Hello, I'm 3rd District Congressman Boozman. As you know, Congress has been considering major changes to our healthcare system. In recent years, we have taken steps in the House of Representatives to try to address this crisis, including prohibiting massive cuts to Medicare reimbursements for physicians and work to implement a new Medicare prescription drug plan that is helping more seniors than ever before. I'm committed to working on reforms that save lives, save money, and improve care. We are facing major challenges, but with great challenges come great opportunities. My background as both a small business owner and an optometrist give me a good perspective from which to work with my colleagues in Congress to lower the cost of quality health care for all Americans. At the beginning of this year, I joined a group of doctors to form what is called the Doctors Caucus. We use our professional experiences to help reform and strengthen our nation's healthcare system and to share our ideas and help educate other members who do not have a medical background. As healthcare providers, we know firsthand the importance of the doctor-patient relationship. Our goal is to develop patient-centered, patient-driven healthcare reforms focused on quality, access, affordability, portability, and choice. Please stay tuned for a roundtable discussion on healthcare reform from members of the Doctors Caucus from across the country who have a unique vision for reforming our nation's healthcare.
Gentlemen, we hear all the time about the Democratic plans that I call Obamacare, but Republicans have introduced actually several bills thus far, and I'd like to just kind of open it up. We'll start with Dr. Cassidy to talk about some of the plans and some of the principles that we need to put forward that we as healthcare practitioners see are absolutely critical to healthcare reform that makes sense for our patients. So Dr. Cassidy, you want to just kind of launch in and talk a little bit about some of those principles that we're putting forward in our plan to reform the healthcare to make it affordable for patients. So if you would, please, sir, just tell us about it.
Thank you, Paul. An overriding principle is that the patient has to be in the middle of the process. I point out to folks that the Democratic plan is only radical in the sense that it nationalizes insurance companies, but it's still an insurance company. They are wedded to a government insurance company instead of a private insurance company. Our plans, if you will, typically look to make the patient more central to the process.
Well, let me ask you a question and interrupt you here a second. You just made a statement that we hear all the time from President Obama and from the Democrats that if you like your plan, you can keep it. And it's my understanding that that's not factual. Is that correct?
Well, of course, it's nice rhetoric. On the other hand, it's pretty clear when you begin to read the bill that the table is tilted so that the advantage runs down to the public health insurance plan, the government-run insurance plan. And so, if you will, there'll be a migration towards the government-run insurance plan just because of the way they have the regulations written.
Well, the last bill I looked at, too, within 5 years, the healthcare czar, it's called the commissioner in the bill, and the panel that he works with, within 5 years has to approve every single healthcare plan in the country, whether it's public or private. So the reality is, if you like your plan, you're not going to be able to keep it because the government's going to dictate the plan for you. So that plan that you have today, whether you buy it through your insurance or whether you get onto the public plan, is going to be dictated by the healthcare czar here in Washington, D.C. So all those private plans are going to go away as we know them today. What's covered in those plans is going to be dictated by the healthcare czar appointed by the president. In fact, Congress is not even going to have any control over that healthcare czar. So it's going to be dictated by the federal government, by the healthcare czar. So if you like your plan today, forget it. You're not going to be able to keep it. Now go forward as far as talking about our plan to put the patient as the center of healthcare.
I'll say one thing.
Certainly, Dr. Boozman.
You know, it's not only us, members of the Doctors Caucus, that have dealt with patients for years, but when you look at the outside modeling, when you look at the independent groups that have looked at this, most people do like their health insurance program. And when you look at the outside modeling, things like the Levin group that have come in and studied this, and even using the President's modeling, you're talking about over 100 million people. Because of the way the plan is set up, 2 out of 3 will lose the insurance coverage that they have. So these are independent groups. This is outside groups. So I think that really is a major issue in the sense that most people would like their plans to be more affordable, but they like the basic health care coverage that they're getting right now.
Well, I want to remind y'all and our watchers, Dr. Fleming just last night was talking about all the people who are going to leave and virtually be forced off their private plan. Dr. Fleming, you want to talk about that?
That's a great point, Dr. Brown. What we have today in Medicare and Medicaid is already a government-run system, much smaller than what's being proposed today. And because the reimbursements for that are below cost for providers, hospitals, and doctors, we have a subsidy situation where private insurance, through our premium dollars, is subsidizing those health care plans to the tune of about $1,800 per family per year. So how long can private insurance keep this subsidy situation up if you take 114 million Americans, which the Lewin Group estimates will be pulled off private insurance?
Now, wait a minute, let's say that again so that our viewers understand what this private, independent, nonpartisan group said. How many people are going to lose their private insurance to be forced into the public?
114 million, which
Wow.
is, by my estimate, about 40% of the population of America. And that's only those who are on insurance. So that's probably the majority of the private insurance market. So if you pull those off and put them in government-run system, then people who enjoy Medicare and even Medicaid today, they're not going to have the subsidies, so their accessibility to health care will go down. People who are under private insurance and enjoy that, they're going to be in the same boat as those in the government-run program. And where the subsidy dollar is going to come to keep that massive government-run system up, they're not going to be there. And of course, we know that just like every other country that's tried this, it's gone into rationing and long lines to control cost.
I've even talked to businessmen and women in my district in Northeast Georgia that have told me that they will pay the extra taxes that the government's going to charge them in the Democrats' pay or play plan that is part of this bill. I've talked to these small businessmen and women that said that they would shift their employees off of their privately employer-provided health insurance and just push them over into the government system because it'll be cheaper for them to pay the extra taxes to do
Paul,
so.
Just taking off on that point, one of the imperatives is that you've got to decrease the cost. Because unless you can have affordable cost, eventually you don't have access. And so we speak about cost, understanding that access is most important, but unless you control cost, there is no access. So the Congressional Budget Office, in their estimate of not just the first 10 years, which would cost $1 trillion more in spending, but the second 10 years suggests that costs will continue to rise 8% per year.
Right.
Well, that's actually worse than the inflation now. And they relate that in part to exactly what you're describing. Folks will just kind of shift to the taxpayer's ticket, if you will, as opposed to something different. Now, ultimately, we know that Medicare is going bankrupt by 2017, and another federal-state program is bankrupting states, and yet we're going to put in a third program, according to the president, to rescue the first two.
Yeah.
Now,
Makes no sense, does it?
this is the triumph of hope over experience.
That's right.
We hope that it will be different, but our experience tells us that no, we're bankrupting one, we're bankrupting the other. The government-run insurance plan is unlikely to rescue the first two.
I saw something just yesterday that's a YouTube video of Barney Frank, which I think is very, very telling, because Barney Frank was just interviewed as he's walking down the street. What he said on that YouTube video is that this public option that they're putting in their plan, that the liberals are absolutely demanding, that is the beginning of a universal, single-party payer, government-directed healthcare system. So that's their ultimate plan, is to get everybody off of their private insurance program, the private insurance that they have today, and push them, shove them into a socialized medicine program administered by the federal government. They want to go to a single-party payer, government-run, Washington bureaucrat deciding type of health care plan for everybody in this country.
And Paul, what's interesting about that is every model you look at, whether it's the states of Tennessee and Massachusetts who've gone this direction, you look at other countries like the United Kingdom, Canada, Australia, none who've gone down this pathway have met with success. Each and every one of them have come up with all sorts of problems with long lines to get into other lines, waiting a year for an MRI scan, and then having to wait another several years to get the needed surgery. And I know this sounds very foreign to people of America, and they think that this couldn't happen in America. But I think people have to understand that we have certainly no new solution to how to control exploding healthcare budgets in the United States run under a government system. And we had hearings recently where we had both professionals and patients from Canada and the United Kingdom talk about their personal situations. And they quoted us all sorts of examples that would never happen in America, even to people who don't have insurance. People waiting, in one case a child who had a brain infection and needed tubes in his ears and a tonsillectomy. And after 9 months, finally they took him to the United States to have this done as a life-saving procedure. He still lost all of his hearing. And we hear examples of people waiting 5-10 years for hip replacement, never getting it, ending up in a nursing home, getting bed sores and dying. This is an everyday reality in these other countries who have the plan that Barney Frank and also Congresswoman Schakowsky has made similar statements. And the Progressive Caucus, in fact, in Congress today. This is what they want for our citizens. And finally, as you know, I introduced House Resolution 615 that simply says that if a congressman votes for a single payer or public option, he should be willing to sign up for it. We've had a number, and I think virtually everyone sitting here today have signed up for it. Not one single Democrat has signed up for it.
That's interesting.
Each and every Democrat.
Why?
Well, because we get, as you know, a private health care plan. I have Blue Cross Blue Shield of Louisiana. I love the plan. And we want to keep that, and the Democrats want to keep it, but for some reason they want a government plan for everyone else.
The reality is that if you have government-provided insurance as a government employee, as we all have, you'll be able to keep your insurance. The congressmen on the Democratic side are going to guarantee that. If you're in a union, you'll probably be able to keep that insurance. If you're extremely wealthy, then you'll probably be able to afford to buy that private insurance. But everybody else is going to be pushed on that government option, that public option that Barney Frank says he wants to push everybody into that healthcare system. So back to what we were originally talking about. We want a patient-centered healthcare solution so that the doctor-patient relationship, so that my patients and I can make decisions. I still practice medicine some when I'm home, and there are others in Congress that do the same thing. But I want to be able to make decisions with my patients, and my patients want me to be able to talk with them, and I'm sure just like y'all have seen with y'all's patients. So the Republican plan leaves the decision-making process in the doctor-patient relationship. But the Democratic plan is not that way. They put a government bureaucrat between the patient and the doctor. And I like Dr. Rowe is in Tennessee has been in that kind of a socialized medicine program where everybody was given some health insurance to try to provide insurance for everybody to have universal coverage. And I'd like Dr. Rowe to just talk to us a little bit about TennCare and what he saw happen there to the quality of care and patient choice and those types of things. Dr. Rowe.
Well, as all of us want quality, affordable health care, and that's a noble goal to have. And it was a goal in the state of Tennessee back in the 90s. As we all remember, managed care was going to be the solution to solving the rise in health care costs and accessibility to care. Well, we put together a plan that I think had 8 managed care plans in the state to compete with each other. Have you heard this story before? And
You're hearing it today here in
you're hearing it
Washington.
again today, 16 years later. And what it did was it took Medicare, we got an exemption from Medicaid, from HHS, to form these managed care plans, which we did. And the health care spending in Tennessee in 1993 and 94 budget year was $2.6 billion. By the 2004 budget year, 10 budgets later, it was $8.5 billion. It had over tripled. Well, what had happened? Well, what happened was 45% of the people who had private health insurance made a perfectly logical decision because it was cheaper, generous with benefits. They dropped their 45%, dropped their private health insurance coverage and went on TennCare. Well, that would have been fine, except what did you get for spending 3 times as much money? Well, we got the most prescription drug use of any state in the union and 47th in health outcomes. And the other thing about that was I then went to my providers, to the hospitals, the outpatient
what
surgery.
health outcomes are. That's
Well,
very important.
the health outcome would be how you rank as far as health in your state. Are you healthier as far as weight is concerned, diabetes, hypertension, prescription drug use? That's what health outcomes are. And I went to the providers, the laboratories and the hospitals and outpatient surgery centers, and I said, how much of this, of your cost does TennCare pay? It pays less than 60% of the costs. Medicare pays about 80 to 90% of the costs. The uninsured pay somewhere in between, and the costs in our state were shifted to private health insurers, forcing those premiums up faster and faster. What will happen with a public plan, I guarantee it, if the sun comes up in the east tomorrow, this is what's going to happen. Businesses are going to make a perfectly logical decision. If they can pay 8% of payroll and it's cheaper than what they're doing right now, they'll drop you in the public plan. This public plan will not pay the cost of care, once again, forcing more people, the premiums higher and higher for those who are left in the private insurance. As you pointed out, Dr. Brown, that very wealthy people will be able to afford it. But the vast majority of people are going to be dumped over time. It'll happen fairly rapidly. We've seen this happen in Tennessee. How do we manage the problem in Tennessee? It was the TennCare program in Tennessee was taking up almost every new dollar that the state brought in. And if you think 17% of the GDP is bad, it took up a third of the state budget. That's how much it consumed. So that will happen. This plan is developed exactly the same. There are a lot better ways that we've discussed here to handle this and to allow patients to make those health care decisions, not a government bureaucrat. And this is not just a gimmick right here that we're showing people. This is factual right here.
That's reality.
This is reality. And I want to point out that right here, this person, that's this health commissioner right here, will decide what's adequate coverage.
That's the health care czar. They're not going to call him that now.
But he's a commissioner now.
Right.
And this person will be one of the most powerful people in the world. And I had an opportunity this last weekend to talk to 2 of my sons. And they said, Dad, if this goes through, if this plan goes through, this will fundamentally change America forever. And it will. And it's not just about how we get care. It's about fundamentally changing the very culture of this society, which I don't think we're ready to do. This commissioner right here will decide what's adequate coverage. And let's say you and I are on the farm as I grew up on, and I buy an insurance policy from Farm Bureau. The president says if you like your insurance, you can keep it. Not true. Because what's in this plan right here, it says that if you have a private policy that you personally own right now, that you can't add any more. This is R right here. It said that's not adequate coverage. So no more people can be added, and no more let's say a new procedure comes out for your heart. You can't add that. So people will drop that, and very quickly there will be no individual policies in America. And why, Dr. Brown, I'd like to have one of my colleagues explain to me now, when you're an individual and you go out, why are you treated differently than a big corporation like GE or anyone else? When you go buy your insurance policy, why do you have to pay more? That's crazy.
I'd be happy to respond to that.
Yeah, please, John.
You know, the health insurance laws that we're under today go back to the 40s. They're archaic. They're not designed for the current present-day insurance situation. And as a result of that, we have very small risk pools. And so a small business or a single owner of a policy is in a very small risk pool.
Explain what a risk pool is.
A risk pool, great question. A risk pool is everybody who is covered, what insurance companies call it, covered lives, they're all put in a pool, if you will, or group.
That's just
of
the
people
group of people that are covered by
that are
that
being
policy.
covered by that policy or under that specific company or what have you. And if someone has to have a lot of cost for their care, for let's say bypass surgery or kidney problems, then there's got to be offsetting income into the plan for more healthy people. Otherwise, the overall costs go up. Insurance companies, of course, take a profit, a small percentage off the top, but everything else has to be covered between young healthy people, hopefully, and older sicker people. And if you deprive that risk pool of younger, healthier people, all you get is a lot of cost. And so currently, someone who enters a health plan alone, who's a small business, or an employee of a small business, they're going to be in the high-cost risk pool, and it may not be affordable. That's easy to fix, but currently it's against the law. You can't buy insurance across the state line. Businesses can't come together into larger groups to create large risk pools. Very simple thing. It will require us to provide incentives to younger, healthier adults to enter their premium dollars, but that's what we should do anyway, because this is a group that's going to the emergency room for their primary care, which is a big part of the problem altogether. So, and hopefully this discussion kind of leads into Republican alternatives. You know, we just dropped the Empowering the Patient First Act, we Republicans, which does not include a single payer, a government-run system. That matrix that Dr. Rowe just held up does not apply to our plan. Our plan also is budget neutral. It does not cost the American taxpayer any more money. It does not provide for taxpayer funding for abortions, which will cause skyrocketing of abortions the way the Democrat plan does. It also provides for liability reform.
Now, a couple of things I want to stop you and then let you go on. The Democratic plan is going to mandate that taxpayers pay for abortions. Is that correct?
That is correct.
That's what you just said.
Well, even beyond that, it'll actually require convenience so that there'll have to be new abortion clinics spring up in convenient locations.
Right. And then the other thing you mentioned is liability reform. Does the Democratic plan have any kind of liability reform to stop?
There's nothing on that chart. Hold your chart up again.
Well, here's the bill.
There's the bill.
And
there's
of
nothing-
all this 1,000 pages, Dr. Brown, there
There's
is
front and
one.
back and very small.
Yes.
There's nothing in the bill, there's nothing in the chart that has anything to do with
Liability.
liability.
There's no
reform.
liability reform at all.
Which in many of our small counties, that's why we don't have OB providers and things like that,
Right.
because they simply can't afford the insurance. So I think we're all uniquely positioned in the sense we've all seen patients come into our clinics that we know, we're struggling to afford the care that we needed to provide. And all of us, make arrangements and do that. And we all agree, that things like portability, you lose your job, you lose your insurance, we need to fix that. We've got people that can't retire now because they're in that gap waiting for Medicare, and maybe they've got a pre-existing condition, or their wife, a family member, so they can't do that. Those are things that we need to do, and I think all of us are committed to doing. My concern, though, is that we have really the best health care system in the world. You don't see our people flying to wherever, to Canada to get care.
Yeah, Canadians come to the
It's
United States
reverse.
to get care instead of the other way around.
My concern is an effort to fix these things that we desperately need to fix.
Right.
That we throw out all the good and go to this very convoluted system. And then the other thing is that I really share my seniors. I'm in an area that has a great retirement population, and they're concerned, and they need to be concerned. You mentioned, the cost factors. The reality is the only way that you can control cost is by rationing care. And
Under a government-
what does that mean?
Under a government,
Under a government system.
What does that
government
mean,
system.
Dr.
Well,
Boozman?
it means that the things that we've come to expect. I'm an optometrist. My brother was an ophthalmologist and eye surgeon. And people, as they got elderly, right now, they can go in a very timely fashion, have their sight restored with cataract surgery. That's become a very, simple procedure, very cost-effective procedure. Knees, hips to relieve pain. We're talking about all of this, and very correctly. We're talking about getting in better shape, preventive medicine, and then you live, and enjoy a long life. and you get in a situation where you need a new knee or something, under these Canadian plans and Great Britain plans that we're being forced into, or they want to force us into, that just doesn't exist.
Dr. Boozman, I just heard from a constituent recently who was in Great Britain and had to get involved in their healthcare system because a family member got sick. And she was talking to a lady in the hospital, or actually the lady's family in the hospital. I think the lady was in her 70s who had fallen down and broken her hip. The British healthcare system denied this patient from having her hip pinned or fixed or replaced because of her age. And that's exactly where we're headed in this country, in that same kind of thing. That lady is relegated to laying in the bed, being given narcotics till she gets pneumonia or kidney failure, and dying because the government plan will not fix her hip. And my constituent was just absolutely shocked that the family has gotten to the point that they said, well, that's just the way the system is, so Mama's going to die. Yeah. And she's going to die in pain, she's going to die in a hospital bed because the government won't fix her plan, and they've become very accepting that kind of plan, and I saw that in Canada when I was up there also. Right. So it's going to be disastrous for the quality of care.
Our system is the one that has designed those hips,
right,
so that we can very efficiently, very effectively, fix those people that are having those kind of problems. And there's nothing, that once that is fixed, there's nothing not to allow that lady to go ahead and lead as good a quality of life as anybody. Resume driving, resume all their normal functions. But when you get into trying to make those trade-offs, where a bureaucrat is going to make that decision versus their physician, and there's real questions, is there something on that chart that allows you, if you do get denied, where do you go to then? What is your ultimate appeal? So what we need is a Democrat-Republican plan.
Yes, that's right.
That the American people buy into.
It's American.
But we're not allowed to be involved in that process.
I agree, and I think this group is unique, and there's more of us, other healthcare providers. We really are in a unique position to help, but this has to be a Democrat-Republican plan. Again, with the American public understanding fully what's going on.
That's right. And maintain freedom and equality in health care. Well, thank you all so much for joining us today, and I hope we helped enlighten people on what the differences is, because there is a Republican plan versus a Democratic plan, and people just need to get engaged in this and contact their congressman, contact the U.S. Senator, and demand the kind of plan that they want, whether it's government-directed or patient-directed.
Thank you for watching. You've just heard our ideas on reforming health care, and now I'd like to hear yours. Please visit my website at boozman.house.gov, where you can email me your ideas and sign up to receive my weekly e-newsletter to keep you informed of the latest news in Congress.